What's up guys, Jeff from Sorta Healthy here. Today we'll be talking about training clients with diabetes. A while ago I did a video on training clients with hypertension or high blood pressure. And since then I've gotten a fair number of comments from people asking me how they should train clients with diabetes. I think just like working with high blood pressure clients, working with clients who have diabetes is something you need to be knowledgeable about as a trainer. If you work as a trainer for any meaningful length of time, most likely you'll have diabetic clients. And there are without a doubt things that are good to do with diabetic clients, and then there are things that are very bad to do with diabetic clients too. There are things that could endanger your diabetic client's safety, and other things that if handled incorrectly on your end could get you into legal trouble as well. In this video today, I'll be going over things you shouldn't do, and then what you should do instead when working with diabetic clients. In today's video, I'll be referencing some health history forms, such as the PAR-Q+. These forms can be downloaded for free at this link located in the video description. When I say free, really everything I'm offering is only 99.9% free. All I ask for in return for the forms and the information is that you like the video and subscribe to the channel if you haven't done so already. This is the best way to support this channel, and this channel is a free resource for all fitness professionals. Thanks for that support, everyone. That's what keeps this channel running. On to the rest of the video. Now, before we start talking about the do's and don'ts of working with diabetic clients, we should talk about the two different types of diabetes, type 1 and type 2. People with type 1 diabetes are insulin dependent. We're still not 100% sure what causes type 1 diabetes, but when someone has type 1 diabetes, their body's cells attack their pancreas. Eventually, the pancreas can't create insulin anymore, and the type 1 diabetic has to inject it. Type 1 diabetes makes up roughly 8% of all diabetes cases, and it usually starts in childhood years, teenage years, or early adulthood. Type 2 diabetes makes up the other 92% of diabetes cases, making it far more common. Type 2 diabetes is very often linked to poor lifestyle choices, such as being sedentary, overweight, or obese. The first thing you'll not want to do when working with diabetic clients is jump straight into working out. This would be true of working with any new client, but it would be a much bigger mistake with a diabetic client since there's more that can go wrong. You'll want to do health history screening before anything else. In your initial consultation, you should be filling out the PAR-Q or PAR-Q+, you should be filling out the health history questionnaire, and you should be filling out the informed consent as well. These forms do two very good things. One, they help to identify any issues that your client has. Two, they cover your ass. If your client has diabetes, you should know about it right away if you have them fill out these forms. Now, if a client has diabetes, they would select yes here on the PAR-Q+. Now, assuming they have nothing else going on, only diabetes, we'd skip down to this second page right here. We'd then have our client fill out these yes or no questions since they apply to someone with diabetes. If potential client is checking multiple things yes on pages of this PAR-Q+, it's usually going to be best to get a doctor's referral before beginning an exercise program. Use your best judgment here, but at the end of the day, err on the side of caution. You always need to think about keeping your clients safe and protecting yourself as well. The easiest way to get that doctor referral is by having your client reach out to their doctor. Plain and simple. The second thing you shouldn't do when working with clients who have diabetes is ignore signs of low blood sugar. It's no secret that clients with diabetes have trouble controlling their blood sugar. In fact, that's the entire issue with either form of the disease. As exercise professionals, we're in an interesting position when it comes to working with diabetic patients. To some extent, with a lot of conditions like diabetes, I like to think of us as soldiers who are on the front lines of a war on health issues. Improving a person's diet, fitness level, and lifestyle can really help to prevent or manage something like diabetes. When we're doing our best work, we can really have a profound effect on all three of those things. That being said, being right there on the front lines has some drawbacks as well. Because of the nature of our work, exercise naturally lowers blood sugar levels. If someone is going to have a blood sugar problem, we're fairly likely to uncover it. Diabetic clients very often take medication to lower their blood sugar, and sometimes their blood sugar can end up lower than what's desirable. Low blood sugar can be dangerous. According to the Mayo Clinic, it can cause things like loss of coordination, it can cause speech issues, and in severe cases, it can cause convulsions or seizures, unconsciousness, or death. In terms of early warning signs and symptoms, some of these things can occur with exercise in general. However, things like dizziness or lightheadedness, having difficulty concentrating, feeling extra weak and having no energy, or having tingling or numbness anywhere, well, yeah, those are all obviously really good indicators that something bad is happening, and you should probably act fast. When you have a diabetic client client displaying any of the symptoms we just discussed, the first thing to do is to take a break. They might just be experiencing normal signs of fatigue and they aren't used to that, or they might be experiencing low blood sugar, or it could be a combination of both things. Either way, it's best to play it safe and take a break for a minute or two when a client, especially a diabetic client, starts displaying concerning symptoms. If things don't significantly improve and your client is still showing signs of hypoglycemia, according to the University of California, San Francisco, your client should aim to replenish at least 15 grams of carbohydrate. Some very quick digesting, simple carbohydrates that would fill that role would be 5 small gumdrops, 5 Lifesavers, and my personal favorite, 4 Starburst. Fruit juice or fruits could also work well here. It's probably good to have some quick-acting carbs or sugars around just in case. You could require your client to bring some with them, or you could just have some ready to go. Either way, don't take hypoglycemia lightly with diabetic clients. It can be dangerous. The third thing you shouldn't do with diabetic clients is start off training at a high intensity. I probably won't talk about this quite as much because I feel like when you're training any new client, you should always start things off with less intensity. You never want to be that trainer who's recently signed a client on for 20 sessions, and you start that package off by beating your client to a pulp. Your initial workouts should be challenging, but they shouldn't be brutal. I would argue that when it comes to working with most clients, you're better off if your workouts are a little too easy rather than too hard. This allows you to ramp up the workout intensity over the coming weeks and sessions. Your diabetic clients obviously have more health risks going on compared to most clients. If you push things too hard initially, you are putting your client in real danger. They're almost always going to appreciate that slow and steady progression. As I've hinted at already, exercise programming usually looks very similar when we're comparing diabetic clients' routines to non-diabetic clients' routines. Try to program mostly compound movements like the squat. If your client needs to modify movements initially, like squatting to a bench for instance, that's totally fine. Just try to progressively make things harder over time. Include other compound lifts, accessory lifts, core moves, again, pretty much everything you do with a non-diabetic client. There are only a few things I would avoid or would be extra cautious of with my diabetic clients, and we'll go over what those things are soon. The fourth thing I wouldn't do with my diabetic clients is detailed nutrition or dietary work. As personal trainers, we can do quite a bit more nutrition-wise than what popular certification courses like NASM or ACE would have you believe. It very much depends on where you live, but most likely you can do a fair amount of nutrition coaching with typical clients. However, and this is a big however, you can't do any nutrition work with a diabetic client or a client that has any other health condition unless you are a registered dietitian or a doctor. For better or worse, helping a diabetic client make dietary changes falls outside our scope of practice. That doesn't mean you're powerless when it comes to helping diabetic clients lose weight though. There are 5 or so things that you can do that will be very helpful for weight loss when working with a diabetic client. The first thing you should do is refer the diabetic client to a dietitian who you can collaborate with. The registered dietitian will be doing most of the nutritional work with the diabetic client. Because of this, I'd highly recommend finding a local dietitian who you can collaborate with on a regular basis. Oftentimes, an RD's services are covered by insurance, by the way. The second thing you should do is see if your RD, registered dietitian buddy, thinks it's a good idea for your mutual client to use an app like MyFitnessPal to help control portions. Most diabetic clients need to lose weight, and that won't happen if their portions aren't in check. The third thing you should do is hold your client accountable. Even though with this client you won't be giving the nutrition advice, you can still do weekly weigh-ins. Make sure your client is recording their food in an app like MyFitnessPal, and make sure that your client is attending those meetings with the dietitian. The fourth thing you can do is give your client physical objectives to do between sessions that will enhance their results. I usually like to try to get clients to aim for 8,000 to 10,000 steps a day. This would be very helpful for some diabetic clients, but it could be a problem for others. We'll go over that soon. Of course, the fifth thing you can do is take your client through exercise sessions, and those will help your client lose weight and achieve their other goals as well. So your best course of action when doing nutrition work with diabetic clients is to rely on a registered dietitian. Your job will be to provide another layer of accountability for almost everything. Just because you can't give direct nutrition advice doesn't mean you can't weigh clients in. Make sure they're tracking their food, and make sure they're showing up to meetings with the dietitian. position. And then of course, you're still the lead person when it comes to a lot of the extra stuff like physical activity, so you still have an important role to play. The last thing you shouldn't do when training diabetic clients is ignore signs of peripheral neuropathy. According to Mayo Clinic, peripheral neuropathy is a result of damage to the nerves located outside of the brain and spinal cord. It often causes weakness, numbness, and pain, usually in the hands and feet. It can also affect other areas of the body functions, including digestion, urination, and circulation. Peripheral neuropathy, which is pretty common in diabetic people, can affect what a client should be doing exercise-wise. Because peripheral neuropathy is essentially nerve damage that usually occurs in the hands, feet, or legs, when someone has that going on, you usually want to avoid very repetitive weight-bearing things, like walking longer distances, for instance. Self-myofascial release, foam rolling being an example of that, can also be a problem. There are some very simple solutions to all of this though. If you know or suspect that a client has peripheral neuropathy, simply don't have them do self-myofascial release on those affected areas or areas close by. I've worked with a client for years who has some peripheral neuropathy in her feet and her calves. I simply don't have her do any self-myofascial release on her lower body at all because it could cause her other issues. She does fine with most dynamic and static lower body stretches, so it's no big deal. She's not really missing out on anything major in her program. When it comes to limiting repetitive weight-bearing things like walking or running, well, the reason you may want to limit some of that is because people with peripheral neuropathy will be more susceptible to further nerve damage, sores, infections, and other concerning things. To minimize the chances of any of that, make sure your client has good footwear. Also, if you're working with a client who has peripheral neuropathy, be ready to break up repetitive things a bit more, especially if they're weight-bearing. If I have a client who has peripheral neuropathy in their feet, maybe I'll have them do 3,000 steps instead of 10,000. Of course, while wearing protective footwear. Since they're getting less steps, maybe I would recommend that they do an extra 30 minutes on the recumbent bike, since that's lower impact than the additional steps. There are multiple solutions to all of this stuff, but if you have diabetic clients, you may want to start game planning for these sorts of things. Having worked with many diabetic clients over the years, peripheral neuropathy isn't something that's guaranteed to be an issue. In fact, it usually isn't. It's still good to be aware of what it is though, just in case. Now, before we wrap this video up, I want to make it clear that this YouTube video shouldn't be your only resource when it comes to training diabetic clients. There's no way I covered everything, so make sure to do some extra research before training diabetic clients on your own. Hopefully this video will help many of you work with diabetic clients in the future and get those people great results. If you guys have any questions or comments on anything, please leave those down below and I will respond to them. That's all we have for today, everyone. If you haven't already, please consider liking the video and subscribing to the channel because it does help the channel to grow, which does allow me to create more free content for all of you. Thanks for watching, everyone. Until next time, stay sort of healthy.